Good afternoon, everyone. Thanks for joining us on our first webinar of the 2018 QCDR series. My name is Karen Orozco, and I work with Alicia Blakey and Zach Smith in Quality Management Programs. This webinar is being recorded, and slides will be sent out after the presentation. We will also be sending out a survey at the end of the webinar to gather your thoughts on today's webinar, as well as ideas for our future presentations. If you have any questions during the webinar, please use the chat box feature at the bottom right of your screen, or raise your hand if you'd like to ask your question verbally, and we'll unmute you at the end towards our Q&A section. We will cover today our 2017 QCDR submission stats. We'll give an overview of MIPS Year 2. We'll review the 2018 QBP timeline. We will also give an overview of our QCDR, registration, and the MIPS portal, as well as the 2018 key dates and milestones. So for 2017, the QCDR submitted data for 225 groups and non-group TINs and over 3,500 NPIs. This is a major improvement for the ACR registries, as we only submitted for 102 TINs and a little under 1,800 NPIs in 2016. Thank you to everyone who submitted their MIPS data using the QCDR. We hope it was a relatively easy process, and we'll continue to make improvements on the MIPS portal and on the submission process throughout 2018. The 2018 MIPS performance categories are the same as last year, but the categories are weighted differently. In 2017, quality was weighted at 60%, but for 2018, quality will count for 50% of your total MIPS score. CMS will begin to calculate cost, which counts for 10% of your total score. Cost cannot be calculated through registries and will be calculated through administrative claims. No data submission is required for the cost category. Improvement activities will continue to be weighted at 15%, and advancing care information will also continue to be 25%. However, if you are a non-patient facing clinician, advancing care may be reweighted to the quality section, giving your quality score a weight of 75% instead of 50%. CMS has removed your pick-your-pace for 2018, so you must submit a full 12 months of data from January 1st to December 31st to receive full credit for the quality category. The 2018 performance threshold has gone up to 15 points, which means that to receive a neutral payment adjustment, you must have at least 15 points. Another change for this year is that the payment adjustment is set at 5%. So clinicians that do not submit data may receive a penalty of a negative 5% reimbursement, and clinicians that do participate may receive up to 5%. MIPS eligible clinicians for 2018 are the same as last year. Physicians, physician assistants, nurse practitioners, clinical nurse specialists, and certified registered nurse anesthetists. Exempt clinicians also remain the same, but I would like to highlight that the low volume threshold has changed to make it less burdensome for clinicians. Last year, the low volume threshold exempted clinicians that billed less than $30,000 a year or that saw less than 100 Medicare patients. In 2018, the threshold has gone up to billing $90,000 a year or less to Medicare, or seeing fewer than 200 patients a year. If you have any questions about your MIPS participation status, please use the link at the bottom of the screen to view your participation status for 2018. There are no changes to data submission choices for 2018. Individuals can submit through a qualified clinical data registry, a qualified registry, electronic health records, or claims. Groups may use a qualified clinical data registry, qualified registries, electronic health records, claims, and the CMS web interface. For those who might not know the difference between a qualified registry and a QCDR, a qualified registry can only submit MIPS measures, whereas a QCDR can submit both MIPS and QCDR measures, giving clinicians more options based on their specialty. Aside from quality measures, the ACR QCDR can also submit improvement activities and advancing care information. As I mentioned before, costs will be calculated through claims and do not require submission through a QCDR. This just gives a couple summary about the 2018 MIPS changes. So as I mentioned before, it's going to be a full 12 months for the performance period for the quality category. The performance threshold has been raised from 3 points to 15. So a MIPS score of 15 avoids the negative adjustment, and a score of 70 or more earns an exceptional performance bonus. A big highlight is the use of appropriate use criteria can qualify as a high-weighted improvement activity if you attest the use of AUC through a qualified clinical decision support mechanism. And non-patient-facing clinicians and small practices, so fewer than 15 clinicians, are exempt from meeting advanced clinical information submission requirements, and that gets related to quality. Small and rural practices are exempt from the QPP if they bill less than 90,000 or treat less than 200 patients a year, as we mentioned before. And small and rural practices will receive 3 points for all measures, regardless of data completeness, as well as 5 bonus points, as long as you submit on one performance category. And this is the Quality Payment Program Year 2 timeline. So the performance year began on January 1st, 2018, and it'll close at the end of December. The deadline for data submission is March 31st, and that's the deadline to submit to CMS. However, to submit data to our registry, January 31st is the data deadline submission. Feedback will be available after March 31st, 2019, and then you should receive your payment adjustment in 2020. And now we'll turn it over to Zach Smith to talk about the QCDR.
Thank you, Karen. I'm Zach Smith. I also work in the quality management programs with Alicia, with Judy Burleson. I'm sure I've talked to a lot of you on the phone or by email, so thanks again for joining us. Just want to remind everybody we will have plenty of time afterwards for Q&A, so please submit some questions to the chat box, and we'll answer those for you at the end. You can also hit the hand raise button. And if you'd like to ask your question out loud, we can unmute you. So feel free to let us know if you have any questions about this stuff. So this part of the webinar is going to be an overview of the QCDR, sort of what it is, how to register for it, how to submit data, that sort of thing. We'll go into a little bit greater detail in our future webinars. So this is just sort of an overview, but hopefully it'll be helpful to you. So a qualified clinical data registry, or a QCDR, is one of the many reporting mechanisms for MIPS participation. So as Karen mentioned, some of the other ways you can submit are by qualified registry, by claims, or by the CMS web interface. So a QCDR is an entity that collects medical or clinical data for the purpose of quality improvement that's been approved by CMS to submit data for MIPS. One notable thing about using a QCDR is this must include patients across all payers, so not just Medicare patients. It's going to need to be Medicare patients and other payers. Now, if you do decide to use the QCDR for MIPS, ACR will submit both your quality measures and your improvement activities, and also if you're required to participate in the advancing care information category, we'll also submit that for you. So it'll be able to cover all of the different performance categories for MIPS, not including cost, because that one isn't required to submit data. These are all the ACR NRDR registries that support QCDR measures. We've got the National Mammography Database, the Interventional Radiology Registry, CT colonography, lung cancer screening, the GRID, which is the General Radiology Improvement Database, and the Dose Index Registry. So all of those are registries that you can be submitting data to. Some of you might already be using near-dear registries, and if you're already submitting data to those registries, then you can just register for MIPS, and then you'll have access to those measures that are available through those registries. And for more information, you can go to the link at the bottom. That's acr.org/QCDR for QCDR information, or acr.org/NRDR for the general registry info. So what are some of the benefits of using a QCDR? For one, the QCDR supports both individual physicians or physicians who are participating as a GPRO, the group practice reporting option. So whichever way you want to submit your data, whether you want to do it on an individual physician basis where each physician gets their own MIPS score, or submit as a group where the group gets one score and then all the physicians in that group receive the same payment adjustment. QCDR can support both of those methods. A huge benefit is that the QCDR includes both MIPS measures and QCDR measures, which were developed by ACR. Therefore, they're going to be more relevant to radiologists. So those, the registries from the previous slide, those each have measures that have been developed specifically for radiologists. And the combination of QCDR measures and MIPS measures should make it a lot easier to meet that the minimum of 6 MIPS measures for reporting. We also provide direct assistance with compiling your data, and we also provide feedback to registry participants. We send quarterly reports for participants in the NRDR registries, and we also have live updates on the MIPS portal under the performance report. So at any time, you can go to your performance report, see which MIPS measures are available to your group, and how you're performing on those measures. And then finally, the QCDR allows physicians to review and select their measures for reporting. So you can look at your measures, see how you're scoring on all of them, and then pick your best for reporting to CMS to ensure you get the highest score. This is just a list of some of our QCDR supported measures. So these, again, are the measures taken from the ACR registries. So this includes 22 separate measures from the NRDR and then 58 MIPS measures. So total, that's maybe 83. I'm not just doing the math in my head, but that's a good number of measures. So that should make it a little easier to get to that 6 that's required for the quality category. And on the right here, this is a screenshot of the AC RAD measures, the NRDR measures, just a shot of how our measure document looks. And we've got more detailed specs posted on the QCDR website, so you can go there, look at the full list of MIPS measures and the NRDR measures, along with all the detailed specs for them. So this next slide is about how to participate in QCDR. And the first thing you should do, as Karen mentioned earlier, is check to see if you're required to participate in MIPS. So you can click that link to go to the MIPS participation lookup tool, and that'll show you if your NPI is going to be required to actually submit data for MIPS. After you've determined whether you have to participate, then you can consider which measures and which improvement activities you'd like to report for 2018 MIPS. So again, those lists are available on the QCDR webpage, acr.org/QCDR. You can go look at the QCDR measures and the MIPS measures and decide which ones are going to be best for your group or for your individual physicians. We've also got a link here to the QCDR participation checklist. And that's just a more detailed overview of the step-by-step process for how to get registered, how to make sure you're all set up in time to ensure that you're able to participate using QCDR. You'll need to decide if you want to report as an individual or as a group. Now, in the first year of MIPS, or actually the last year of PQRS, you had to choose whether you're going to be a G-Pro in the middle of the year. So there was a deadline for it, but as of last year, you don't have to do that. You can change between individual or G-Pro as much as you'd like. And you just have to make that determination before you submit your data, which you'll do in early 2019. We'll charge the fees in March 2019. So we don't charge you until after you've determined for sure that you want us to submit MIPS data for you, and you've actually selected your measures and attested that you're complete with your submission. So those invoices will go out in March. The fees are still the same. It's going to be $199 per physician for ACR members, and for non-ACR members, it's still going to be $1,299 per physician. And we've got a link here for the registration process, just a more detailed overview again. So If you're not currently submitting data, you can go there to get started. And I should mention, we will be sending these slides out to everybody and a recording of the webinar. So we'll probably get that to you early tomorrow. So if you missed it, then if you missed the first part, then we'll get that out to you soon. I thought I should mention some tips and suggestions for new registrants, just to make sure you're set up correctly before it's too late. We had some groups last year that you know, if you kind of wait to the last minute, you might find out that your registration isn't as complete as you thought it was, and if you find out too late, you can kind of you'll have to be rushing to get everything corrected so that you're able to submit data. So these are just some tips to make sure your registration is set up correctly, so that you can get your measures submitted without any problems. First, we want you to make sure your facility is actually registered for MIPS. So if you're registered for NRDR, but you're not registered for MIPS, you're not going to be able to choose MIPS measures or submit MIPS measures until that's complete. You also want to make sure any relevant NRDR registries that you want to submit QCDR measures through, you want to make sure you're registered for those as well. Next, you'll need to add your TIN under the Managed Physician Group TIN section and upload your TIN documentation. That's just any type of form that proves that your TIN is correct. You'll need to make sure you have that done and that your physicians have been added under Managed Physicians. And you want to make sure that they're associated with the correct TINs and with the correct registries, and that their NPI has been entered. We do have an Excel template available that you can populate all the physicians' names in. So that's probably the easiest way to do it. Just fill out that template, upload the template, and then that'll populate all the physicians into the Managed Physicians page. One thing that was required last year that's going to be a little bit different this year is the physician attestation process is going to be a little bit more automated. So if you use the Excel template to upload your physician list, the physicians are not going to also have to log in and attest to MIPS participation. That was a big hassle for groups last year, and a lot of people complained about it. We weren't too happy about it either, so we decided to change it for this year. So if you use the Excel template and register your physicians that way, then they're not going to have to log in individually to attest to MIPS. So hopefully that eases some burden for new registrants. Now, if you've already registered, if you participated in MIPS last year, then you're not going to have to worry about any of this stuff. As long as your physician list is still the same, your TIN hasn't changed, then you're not going to have to change anything. So just log in, make sure your physicians are all correct, but you're not going to have to worry about attesting again. And finally, for new and returning users, we recommend that you check your performance report and your quarterly feedback reports regularly, because that's going to help you monitor your MIPS performance. You'll be able to check on which measures you've submitted data for and how you're scoring on those measures. So that's a good way to find out maybe if you're having any problems with your data. You can look at your performance report, and if everything basically looks right, then you'll know everything's coming through correctly. But that's a good way to help identify problems early on. Now, this shows you how to access the MIPS participation portal. It's going to be accessible to any facility that has registered for MIPS, and it's available all year. You can go to the MIPS portal anytime. It doesn't just have to be at the end of the reporting cycle. And it's going to include a summary of all your MIPS registered physicians, and it's also going to include the performance report where you can see all your quality measures. And this is also where the final CMS submission tab is, where you'll go at the end of the cycle to choose all your measures for reporting to CMS. Now, this is what the performance report looks like. This is showing one of the physician group TINs and then one of the measures that's attributed to them. You'll see here on the left, they're blurred out, but these are where you would see physician names and then how many cases are attributed to each physician. You'll see there's a column for the total number of cases submitted in the denominator, the total number of performance not met and the number of performance met, as well as any exclusions or things like that. So this is a really useful screen to look at to just get an overview of your group data or your individual physician data and how you're doing. This is just a small screenshot from the CMS submission tab. It looks pretty much the same for GPRO or non-GPRO submissions, but it's going to show you a list of all the TINs that are linked to your account, and you're going to be able to go in, see which measures are available, and then select them for finalization. So this is available to look at all year, but you won't actually be able to finalize anything until the end of the reporting period. So after about January 31st, 2019, once your data has all been submitted, then you'll be able to go in and finalize your measures, your improvement activities, and your ACI measures if necessary. And again, this is under the MIPS participation portal with, along with the performance report. Here is the overall timeline for participating in the ACR QCDR. Our first deadline is coming up October 31st. That's when we want you to have your MIPS registered to your NRDR account and some data submitted for each registry you're using. So for every NRDR registry or for MIPS measures, we want you to, you don't have to submit all your data, but just some for each registry. And of course, just make sure you've actually registered for MIPS and send in your participation addendum for MIPS. Now, you can be submitting data for the entire year. You don't have to wait until October 31st to do it. You can start doing that as of about mid next week, we think. So if you've got files to submit, you should be able to submit them pretty soon. So if you start doing that now, then you should be good by October 31st. By November 30th, we want you to make sure you've added all the physicians to your account and all the child facilities and TINs. So just make sure basically that your account is set up correctly with all the right people in the right locations. By January 31st, as we already mentioned, that's when we want you to have submitted all of your data for 2018. So hopefully you're able to get everything in by January 31st. We would like to not accept any data after that, but we'll see what happens. And then between January 31st and March 15th, that's when you'll need to finalize your measures, select your improvement activities, and just confirm that your data is all good to go to CMS. That's also when we'll send out the MIPS reporting fee, the invoice for the reporting fee. So that'll be mid-March, and then March 31st is the deadline for ACR to send your MIPS data to CMS. So finally, before we start the Q&A, we just want to highlight that we do have the Help Desk and Solutions Center available for anybody who has questions about NRDR or MIPS. So this is going to include a selection of articles all about the process, so both for NRDR participants and for MIPS QCDR participants. There's going to be a lot of articles here that will help you understand the process and walk you through what you need to do to submit data, to get registered, whatever you need. So that link is here, nrdrsupport.acr.org. Here's our contact information. You can also submit a help desk ticket at the same link, nrdrsupport.acr.org, or you can send an email to nrdrsupport@acr.org, or call us at the number below. And this is a picture of all of our lovely colleagues here who are sitting in the room with me. And that's about it for the presentation. We can move on to the Q&A now. So if anybody has any questions they'd like to read. Give us just a moment. I know we've been getting some.
Here's a question from Ian Gass. For the data file submission, are there any plans to add a child facility ID field to make data submission easier? Yes, that's true. we are adding a facility ID field to the file specifications so that you can upload multiple facilities in the same file. Did I say that correctly?
That's correct.
Yes.
I noticed we have a hand raised. Priscilla Torres, if you still have your question, I'm about to unmute your line. You are now unmuted.
Are you there, Priscilla? Guess not.
Does she have a written question?
I don't think so, no.
Okay. Lisa Fowler has a question that I don't think is complete. I noticed that the totals did not add up to the GPRO denominators and numerators. Could you ask that in a different way, Lisa? I'm not sure I understand that. Does anybody here get that?
Yeah, I'm not sure if that means, say, in our screenshot or if she submitted and didn't think her data was correct. So if you could clarify that.
Will we be getting an email notification when the MIPS portal is available to enter billing company name? You mean, I think you mean as a registry user or a facility user? We currently don't have plans to do that sort of account, although a representative from your billing company you can authorize as a user on your account.
Here's a question here from Karen Harmon. She says, can the registration accommodate a physician group 10 and the facilities 10 in the scenario that the group reports MIPS measures and the hospital reports QCDR measures? If you could touch on that. I mean, that's the essence of our program, is that we do allow you to connect your hospital with the medical group. Jake and Karen, you care to elaborate on how that interface works? So yeah, so if you as Karen and Zach mentioned, through your NRDR registration, you're giving us all of your physicians and you're giving us all of your locations. So we will be able to aggregate all of your data using your provider's NPI and tax ID numbers, and it will be displayed in your MIPS portal.
Question from Joanne. Just to verify, if we had all of our doctors and locations as a GPRO for 2017, there is nothing we need to do for 2018 as far as registering. That is correct, as long as your doctors haven't changed and you don't have any more locations to add. So if everything has remained the same, then you don't have to add or do anything different for 2018.
Laura Springer asks, do you have any slam dunk IA for radiologists reporting with a QCDR? Zach can answer that.
I can recommend some. I don't know if you're, well, for one, we've got a document on our QCDR page that shows a list of all the different IAs available, and then we have some recommendations in one of the columns for which of those IAs we think would work with some ACR-related activities or just would be relevant to radiologists. So I would check that out. That's on acr.org/QCDR. One of the big things that we've been recommending, so I don't know if you're familiar with our RScan program, but it's basically it's a free-to-use tool that helps radiologists and referring clinicians get together and work on improving image ordering appropriateness. So again, it doesn't cost anything to use. It's not super time intensive. The general idea of it is you look at ordering data, try to determine how appropriate some of the exams being ordered were, especially in, say, emergency scenarios. CTA for pulmonary embolism is a big one. Imaging for low back pain is a big one. So areas like that where there's some imaging overuse, that has been approved for 7 different improvement activities. So if you participate in an RSCAN project, then both the radiologist and the referring physicians, if they're required to participate in MIPS, would be able to claim as many IAs as they need for full IA participation. So between RSCAN and the document on the QCDR homepage, I think you should be able to find some IAs.
Yeah, and just to add to, thanks, Zach, that was helpful. And just to add to that a little bit, there are several IAs specifically looking at participation in a QCDR, and you would need to look at the subcategory that they're in to really know which one to use, because there are some that look at that promotes processes and tools for engaging patients for adherence to treatment, which may not be really that relevant to the registries that you're participating in as part of near-dear, but there's some that look at, like, promotes patient safety and are used for doing quality improvement. So just read the IAs that are relevant to QCDRs and you'll find several.
Nellie asked, how do we make sure our billing company is sending all patient data and not just Medicare? Using the MIPS performance report, you can see all the data that's been submitted for those measures, so you would be able to see there if you're getting all of the patients. Courtney Carroll asked, do we need to verify our TINs and physician accounts for 2018 if we used the QCDR last year? The answer is no, as long as everything is the same.
One thing, there are always physicians retiring or changing practices. It wouldn't hurt to go into the managed physicians list and just make sure everything's all up to date if there's any cleanup you need to do. But as Karen said, yeah, nothing you need to do if nothing has changed.
I'd also like to add some information about the question about adding facility ID to file uploads. That is in place for the CTC, NMD, lung cancer registries, not GRID, and also MIPS.
Katie Sarah added to an audience question asking whether the measure would be automatically reported if we use NMD and DIR registries, or if they need to submit that data separately. She's asking if they need to get on and pay $200 per physician to submit for MIPS. The answer is yes. If they are an ACR member, they would pay $200 per ACR member to submit for MIPS. The second part of your question, yes, they do need to register appropriately to make sure that those measures get selected as CMS. So if you are registered for DIR and NMD, you also need to add MIPS to your registry in order to be able to submit QCDR data to CMS.
And just to add on to the discussion about improvement activities and RSCAN from earlier, if anybody's interested in looking into RSCAN a little bit more, you can find more out on rscan.org. That's rscan.org.
There's a question in here from Deborah Fenton. She's asking why can't GRID turnaround time measures be reported through the master facility like the MIPS quality measures? I want to talk about some changes that we're going to make for 2018, where we really do encourage data to be submitted at the child facility level instead of the master.
And one of the main reasons for that is that if you're thinking of the near-dear in terms of near-dear itself, unrelated to MIPS, the feedback reports that you receive are at the facility level, and so they're based on the data at that location. And to make those reports accurate, then we need to receive the data just from that location in order for the feedback reports to be really applicable to the services at that facility. Okay, good.
We've got a question here from Denis asking, what is the participation addendum for MIPS? That's only something that you need to send to us if you're adding MIPS to your NRDR registration. It's just a legal document that addends the business associate agreement you've already sent for NRDR. So if you're registering for the first time, you're just going to send in a regular NRDR agreement. But if you're already registered and you're adding a new registry or adding MIPS to your registration, it's just a form that you'll fill out, list which facility IDs are going to be associated with MIPS, and then you send that in to us. And you can just send it to this NRDR support email address, and we'll take care of it that way. But that's only if you haven't done this already, and this is your first time registering.
Abid Sitar asked, do we need to resubmit NMD data now that NMD 2.1 is out with additional field requirements? And those fields are related to the new Medicare beneficiary ID that CMS has begun distributing. So we needed to add that field to the file. And it also adds the facility ID field. No, you do not need to resubmit data using that template. And you can continue to use the 2.0 template as well.
Vicki Casey has some positive feedback for us. The timing and format of the GRID QCDR report is a very good reporting tool for MIPS. Are there plans to provide similar type reports for the other registries, DIR and NMD? The timing and format of the GRID QCDR report is a great supporting tool. Is there any plans to use this same format for the other registries? I mean, the short answer is that QCDR preview reports are available for each of the clinical data registries.
Is the GRID one separate? So I think that, yeah, the GRID QCDR preview report is separate from the regular facility report. The other registries like DIR and NMD have that contained, that there's a section in the regular report for the QCDR measure information. Courtney Carroll asked, if we upload data quarterly, do we need to group the data annually for final submittal? No, you don't need to do that. We keep the data that you already submitted. But if you do submit other data for previous quarters, then that will be aggregated at final submission or reporting.
We have a hand raised, Lisa Fowler. I'm going to go ahead and unmute your line. You are now unmuted.
You still have a question, Lisa?
I was asking why in the screenshot the group numbers, denominators and numerators, did not equal the individuals down below.
Let's see. Oh, because there were more physicians listed. This is just a small segment that we could fit, but there are, it goes down further, and there are actually 5,794. Yeah, thanks, Lisa.
Okay, Greg Worth had a question. If a group reads for more than 110 and had registered 110 with the NRDR last year, 2017, and would like to add or register a second TIN, can these two TINs, master facility IDs, be linked together? If so, are the providers invoiced once for both TINs, assuming they are submitting traditional data?
Give us just a second on that one.
Reg? Would you repeat the question?
If a group reads for more than one TIN and had registered one TIN with the NRDR last payment year, 2017, I would like to add or register a second TIN. Can these two TINs and their master facility IDs be linked together? If so, are the providers invoiced once for both TINs, assuming they are submitting traditional data?
Group reads for more than one TIN.
So it sounds like they read for two TINs, but they did QCDR for only one of their TINs last year, but now they're thinking about doing QCDR for both.
Yes.
So adding a second one.
We don't charge for multiple fees for a group that has multiple TINs. So if they're registered as a group in Near Deer, we're charging at that level, not for their TINs.
And it can, I guess, be linked together?
It sounds like if it's a situation we're thinking, you could just add both TINs
To the
under your
group.
group TIN
Yeah.
page.
The
And
group's facility.
right. And then just make sure the physicians in that group are linked to both TINs. And then you should be good, and no, it wouldn't be a separate fee.
Looking. Did someone answer Janine's question? Janine asked, is data submitted via claims required to be submitted to the MIPS portal too? So I think you're asking, can you submit measured data using claims and also submit through the Near Deer portal, through the Near Deer, and get credit for both. You know what, I'm going to have to go back and check that, but I think the rule for 2018 is you can use multiple mechanisms for a category. So you could submit claims measures and registry measures separately, but that may not be until 2019. So let me just, 2019. So just to recap there, that has been discussed in CMS rulemaking that you can use multiple reporting mechanisms for a category, like the quality category, which would mean that you could report some measures using claims-based submission and some measures using the registry and get credit for both types of submission. But for 2018, it remains the same as previous years, where CMS will only calculate a score from one mechanism. They'll look at both methods. Method results in the better score for the individual physician or group they will use, but they won't combine the measured data.
Courtney asked, if we upload data quarterly, do we need to group the data annually for final submittal? In the MIPS portal, it's organized by measures, so all your data that you've submitted quarterly will be there for the full year, assuming you've submitted data for the full year.
And Nellie Zargarian asked, does the MIPS dashboard give you a projected score? Yes, in the MIPS portal on the
CMS submission.
CMS submission tab, once you enter the, once you've selected a measure and you enter your reporting information, like the percent of reporting that you've done, submission of data, the data completeness, then a projected decile will be calculated for you.
We should mention, because we got a lot of questions about this over the last couple months, some of the registry measures have not been benchmarked, and those are going to, in the CMS submission tab, they're going to show a score of 3 points because that's the minimum they could possibly receive. But for those registry measures that aren't benchmarked, they could be calculated to receive a higher score. So for those, it might say 3, but you might actually be eligible for a higher score.
Doris, you have your hand raised. I'm going to go ahead and unmute your line. You're now unmuted.
I'm sorry, can you hear me now?
Yeah.
Okay, hi. I'm sorry if you guys already mentioned this. I may have missed it. But can we begin uploading our data for 2018, or do we have to wait on that?
It's going to be ready soon.
Okay.
We're hoping next week it should be available to start actually receiving your files and calculating your performance. So we'll send a blast email out when that's ready to go, I think.
Okay,
Yes.
perfect. Thank you.
But you can always and should, if you're using the registry, continue to submit data all the time.
Right.
Or quarterly, whatever fits your process better. But
Right.
you can always.
Yeah, we do it quarterly, so we have our first quarter ready. I just haven't uploaded it yet because I didn't know if I could.
Oh yeah, for those you're good to go. It's just for the MIPS measures that we're not quite ready yet.
And just to give you a little bit of background on the MIPS file specifications and being able to submit the current year's data, the process that is required is to go through the specifications for each of the measures that we support, each of the MIPS measures that we support, and update the numerator and denominator codes and ensure that in many instances the logic of the measure has changed somewhat, so the codes may be, the way that we receive them from you may need to be different, so it does take some time to go through those and make sure that they're correct. We are working towards pushing this earlier every year, so we hope to get the 2018 out to you soon, and for 2019, hope to make that much sooner than this point in time. It's also that the way that we segment the years in the MIPS performance portal, we haven't broken those apart completely in the past, and we're working towards making previous years' data to continue to be available to you, and so that would also enable the current year data to be submitted earlier as well.
Okay.
Good question,
Thank you.
Doris. Thank you.
Yeah, more than fine. Shelby King asks, what do we need to do if our physician group reports MIPS by claims and our contracted hospital submits data using the lung cancer screening registry to connect the two in order to count this lung registry as our IA? So you can still, you don't have to use near dear for quality reporting in order to get credit for the QCDR IA. You can still use that, and you can submit your IA through the QPP portal, or if you wanted to use the near dear portal and go through that to submit that IA, you could do that also.
Lori asks, our doctors at the hospital with different TIN than our group have been participating all year in registries, for example, NMD. Once the proper registration and TINs are linked with child sites set up, etc., will the MIPS portal pick up everything that's been there since the beginning of the year? The answer is yes. That's a really good question. Thank you for asking that.
Well, as you said, it is contingent on getting all that stuff set up correctly. But once you've got the TINs in and the physicians all linked up, then yeah, any data they've been submitting this year will start showing up in the performance report.
Yeah, and so just to give you a little bit more background on that, the registry data for your quarterly feedback reports is aggregated at the facility level. That's the structure of NearDear. But for CMS reporting, since it's at the group level, we aggregate by the 10 for the MIPS performance portal. So you'll see all your, whatever facility your 10 is associated with, that data will be pulled into the relevant measures in the performance portal, the MIPS performance portal. Trina Howard asked, is the reporting 50% or 60% of the EP's applicable patients? It was increased to 60% in 2018 from 50%.
Shelley asks, where do you find the fee per registry? We have a master with several children and each facility uses different registries. Does the invoice in the master reflect the balance for all? I think it's one invoice if it's at the same site.
Right.
Where you find the fee per registry. She has a master with several children and each facility different registries. And does the invoice in the master reflect them all?
That if it's the invoice goes to the facility administrator at the master level.
Mm-hmm.
And so it should cover all the...
So it should cover all of your
Yeah, it covers everyone under the umbrella.
Yeah.
Thank you.
Well, Rick Sylvanus didn't have a question, but he just wanted to say it's fun to see faces that go with the names. And thanks. We feel the same too. So sometimes we're out in the world, we might run into one or the other of you, and we like to see your face too. So if you want to send us pictures, do that. We might put them in the next webinar. Okay, what else? Nellie Zargarian asks, so just to confirm, we are planning to have our billing company send in claims data and working on NMD. Oh, somebody just answered that. Does that go to everybody? So just to confirm, we are planning to have our billing company send in claims data and working on NMD and DIR measures. The physicians can choose all these measures, but CMS takes the best score. So I think what you're saying is you're continuing to submit measured data using claims, and you're also submitting data to the registry for NMD and DIR measures, and you intend to submit data from NearDear for that. The physician can choose from NearDear which measures they want to have submitted, and then, so if you have a claims-based submission and then measures from NearDear that your physicians chose, CMS will look at the claim submission and see what the result is, and then they'll look at the registry submission and see what the result is, and use the one that gives you the best outcome.
Anthony says, this is like another language. Is there literature where I can find to better understand this process? You can go to nrdrsupport.acr.org to find solutions on all of our registries and on the QCDR. And if you want more information on the quality payment program, you can go to qpp.cms.org, and they have a resource
.gov.
Oh, .gov, sorry. Thank you. To find resources on the QPP process for 2018.
Maria Benevenito asked, we are part of an ACO. We were told for 2018 we would be included as part of the ACO reporting. Should we still continue to report to the QCDR as an individual facility? I think that's a good question, but there are certain things that you would need to confirm about the ACO, whether you're on the individuals in your 10, and probably you've already done this, but individuals in your 10 are included in their roster. Are they submitting as an MIPS APM, or are they a advanced APM? Which category do they fall into? And that might help you to determine if you want to use the QCDR as a backup. And I'll just have to say to Anthony, even though Zach did give you, and Karen gave you a location for more information, it is another language. and we feel, we all agree, we empathize. Oh, Lori wants to know who's in the pick.
You'll just have to guess.
We should have a contest. Okay.
I think it's time for one more.
Okay. Got you. Mike Bowl asked, if our facility starts using Radiometrics for dose monitoring, do I need to continue using the Triad servers? Yes.
Anything else you want to read real quick, or?
I'm trying to see a quick one.
All right. Well, thank you guys so much for listening in and for being so kind to Zach and I. This was our first webinar that we posted together. Normally people listen to the webinars in the past. It's been Alicia who's run them all. So thank you all very much for joining, and we will send out these slides at the end of the presentation. So, thanks.
Thank you.
Thanks.